nervous.
I don't want you to be nervous. Oh, hold on. Wait a second. Hi, guys. Everybody can hear us. We're YouTube Live. Hold on. I'm going to sneak around over here. I forgot. See, I'm still basic like this. We're going to hit record over here. Uh-oh. What's going on now? Card full. Which one? There we go. See that? Everybody just saw that mistake. I'm sorry, guys. It's completely my fault. Oh, man. We're starting off on a downside. It's okay. We're going to restart right now. Hello, everybody. Good evening, and welcome to the local BizCast. As you probably know, I am Dr. Pete by now, and I am really excited to announce my best friend over here, my guest who I've known for so many years. Oh, my God, and we go way back. There's another thing. I don't know if you know, I teased it on one of our on our trailers. Oh, my goodness. Ladies and gentlemen, it's Dr. Aura Caldera, Pediatric Dentist Extraordinaire, Valley Smiles Pediatric Dentistry. Welcome.
Thank you. Excited to be here.
Are you really excited?
I am, Dr. Pete.
We've got a lot to talk about.
We do.
Okay, but before that, little business in hand. I've learned, thanks to my mentors, that we want people to like and subscribe. So if you are enjoying the local BizCast, please go to YouTube Live and go to local BizCast and hit like and hit subscribe. The more subscribers we get, I don't know what happens. I guess more people watch it and it's more fun. And we get more amazing guests. We go viral. Let's go viral. We are also on Spotify too. So you can go to Spotify and do that. And one of the girls on my team said that if people want to get on the podcast, how are they supposed to get on the podcast? How are they supposed to contact me? And I'm like, I never even told people how to do that. So, ladies and gentlemen, if you'd like to get on the podcast, you can go through the local BizCast on Instagram. You can go through the local BizCast on Facebook, or you could just email me directly. And I'm Dr. Pete at shcnj.com. That's the Spine and Health Center of New Jersey.com. You can email me there. But my business is over. I already took 44 seconds of business. I hate it because we have so much to talk about. Ladies and gentlemen, Dr. Aura Caldera, say hi. Say hi to the world.
Hi,
Talk
world.
to us.
Thank you for having me.
You're
I'm
so welcome.
Excited. Pete and I have known each other a long time. Pete went to college with my big brother, actually.
Who was my big brother.
That's
Well,
right.
actually, not really. His best friend was my big brother, which is
Close
weird.
enough.
In our fraternity. So, Frank, a little shout out, buddy. It's been a little while because every time you've been here, I've not been around at one of the parties. So I actually haven't seen you since 1998 when you graduated college. But Dr. Frank Caldera over there, he's in Philly, isn't he?
He's
Or is it
in Mount Laurel,
Mount
South
Laurel.
Jersey.
Nah, Philadelphia. But we're not talking about you tonight. We're talking about your amazing sister, who is a pediatric dentist extraordinaire. Tell us a little bit about you and your practice, because that's important.
So my practice is located in Ramsey. We specialize in pediatric
Little
dentistry.
guys.
Yes.
Aww.
And for those of you who don't know, it's February, which is National Children's Dental Health Awareness Month. And so this is
I feel like you just made that up. It's like National Children's Dental Health Awareness Month over there. So
I didn't make it up.
All right.
And so, we're here to bring awareness about, establishing a dental home. It's always easier to prevent issues than it is to treat them. And so the American Academy of Pediatric Dentistry, the American Academy of Pediatrics.
Is she getting paid by them to plug this right now over here?
Recommends first visit by age 1.
Okay.
So,
and that's a problem. I saw you wrote in here, like there's a serious issue with regards to dental hygiene or dental health, right? You were saying there's like a number one, what was that? Like,
I know most people don't know this. I feel like it's not covered in media, and
right.
Pediatricians don't really bring it up, but cavities are the number one chronic childhood disease that affects Americans and American children, 4 times more common than asthma.
What? I mean, that's crazy. First of all, like everybody has asthma, and you're telling me it's 4 times. Don't they have baby teeth? Don't those leave? What?
That is a very
common misconception. What is it? Yes.
So, another really interesting fact is that 40% of children will develop a cavity before they even enter kindergarten.
Are they eating that much sugar?
There are a lot of risk factors.
Okay.
Definitely diet is one variable, but it's also your hygiene, your genetics, your tooth anatomy. So that's sort of what we're looking for, assessing your
Oh my
risk,
God.
come in, we'll take a look, and we'll give you a lot of tips to prevent those issues from happening.
Guys, just in case it sounds like Dr. Aura Caldera is the smartest person you ever met, it's because she is. She's the smartest person I know. She's like an NYU graduate, Columbia University dental. She's the cream of the crop. She's the top of the top, and you can hear it right in her voice right now, quoting statistics, being all types of smart. It's so amazing, though. But you're an absolute
You're
stud.
making me blush. Thank you.
You
for
are an
saying that.
absolute stud. So, but I mean, it is pediatric. I can't even believe. Obviously, my children go and see you and get it, and it's just not enough. I know I'm getting the reminders over here, but
Yeah, I'm passionate about smiles, guys. Smiles are important. It's the first thing that we see. They're universal, right?
Your smile makes me smile.
Listen, your smile instantly instills like my trust in you, and your gives off confidence.
No.
And so it's important. We want to preserve those healthy smiles. We're living longer, and so let's get started. Let's prevent issues from happening. Get in early.
Super early. I mean, you start in just habits, right? I mean, you're talking about like an easy, benign, behind the scenes habit. Like if you start that day one, it's just something that you do. You just brush your teeth day and night. You just floss. You just
we make good choices about the snacks that we're eating. We're visiting the dentist regularly. Don't come in, once a year. The recommendation is at least every 6 months. If you're higher risk, sometimes it's more frequent. A lot of different, using a fluoride toothpaste would be really something that is beneficial.
Are we going to go into toothpaste, or some are better than others, huh?
Yes.
Uh-oh.
Yes. Also depends on your risk.
Okay.
Right. So if you are higher risk, you definitely want to be using a fluoridated toothpaste. Sometimes it's even a medical grade for fluoridated toothpaste. So we can give you options. And for those people who are, have concerns about using a fluoride toothpaste, we have alternatives.
It's so interesting. Most of us have no idea. You're right. There's just no coverage of this.
No.
Happens in my profession as well. But I do say, like, I always try to compare us to dentists because there is the somewhat a semblance of knowing about dental hygiene, right? People know to brush their teeth, and whether they do it or not is something like that. And we don't, there's not enough. There's not enough. There's no spinal hygiene. People don't know, ever even heard the term spinal hygiene. But you're saying, great, we know about dental hygiene. That's about all we know.
It really is. And it really, I put a lot of onus on pediatricians to bring awareness, because they're the ones who are seeing parents and infants at a young age, and they should really be the ones bringing attention and awareness and making those referrals.
The gatekeeper.
The gatekeeper. Yeah. So, I mean, actually the recommendation is within 6 months of like when a tooth erupts, or by age 1. So whether or not a child has a tooth by age 1, they should be seeing a dentist.
How do you know? I mean, we don't know this. How do we get this out? The local bizcast. That's it. We're going to go viral with this one because people did not know that. It's just insane. But I love not just that fact that you're a pediatric dentist and all that kind of stuff and where you're at right now, but I also love to find out how you got here.
Oh,
so,
my goodness. All right.
You know, it's important.
Let's bring it back.
How far back you want to go?
So, born and raised, Staten Island, New York.
Finest. Shaolin's finest. I've been to that house. I've swam in that pool. I know what you're talking about. Yes. I know where you were.
So funny.
Yeah.
I'm a first generation American, a Nicaraguan American. My parents came here from Nicaragua. They are both doctors, and they definitely actually had a big influence on, my choice to go down like a healthcare. I would say my dad was a surgeon. My mom was a pediatrician, and it wasn't uncommon for my dad to like be stitching up the kids in the neighborhood. I have 2 brothers. Someone was always hurt. Their friends were always hurt. And our house was like the triage emergency department.
It was the pre-ER.
Yes, it was.
Yeah, right.
It was. So like my dad would have his equipment there. We'd be sitting there like
super sterile kitchen that you had over there, right?
Yes, it was different times.
I love that.
It wasn't uncommon for him to be like showing us like really gory videos of him doing surgeries.
What did he have? Like the whole camcorders in there?
Like pictures, and would educate us, and I became very desensitized to blood and organs. Yeah.
What kind of surgeon? Was it just general surgeon?
General surgeon, okay. But he did a lot of like hernia repairs, and ultimately specialized in breast cancer removals.
Okay.
Yeah.
Amazing.
Yeah. And then my mom is a pediatrician, and she had a practice in Jamaica. Jamaica, Queens, and in my summers, starting in middle school, she would take me to her office to work. So I was
Wonderful. Nice summer vacation you had
Yes.
there.
So, I mean, I was weighing the infants and checking people in and out, doing administrative tasks. I was in 7th grade calling insurances,
Yeah.
submitting claims.
You sure you
So
want to be a dentist? I could probably use you. Are you kidding me? What unbelievable. That's incredible.
again, desensitized to screaming children
Right,
at a
right,
young
right.
age. And
I can see the combination now coming all together.
see?
Oh my goodness. You don't need therapy for this. We know exactly what's going on here. Oh my God. So, all right. And that was for years. I mean, oh my God.
Yeah. So, I mean, again, I didn't know at that age where I would go, but I think ultimately that played a pivotal role
Yeah.
in, where my path went.
Okay.
Yes.
But-
And good.
But then you went to school, was there a possibility of being a surgeon or a pediatrician or?
You know what? So I think I kind of ruled out. My brother is a physician, so not only did I see my parents and what they went through as physicians, it was hard. There were definitely challenges for them. They, although very talented, skilled clinicians, there was a little bit of a cultural and language barrier that,
I can understand
had some
that.
challenges in their
Yep.
professional life. So they felt more comfortable opening up a practice in a Latino community in Queens, my dad in Flushing, my mom in Jamaica, even though we were living in Staten Island, which was like in a very Italian, Irish community.
I could have sworn you guys would be Italian.
But I know Caldera.
Yeah, I mean, come on. It ends with a vowel. Come on. So, but
well, all my friends are Italian. I think I'm an honorary.
you're by
member of the Italian community.
association. You're
Yes.
fine. We'll give you a tag.
Thanks. So, they commuted an hour and a half, and my dad, it wasn't uncommon for him. He would come home from a 2-hour commute sitting in traffic only to get paged to have to go right back
Oh my God.
to Flushing. So that was like difficult to watch. And he didn't complain about it. The guy was committed to his craft and his patients. He was a very hardworking individual, as was my mother.
Yeah.
But I knew I didn't want that.
Right. Okay.
And I saw my brother who's 5 years older, go through medical school. Not that I do like, dental school is really hard, but medical school
was tough.
really tough.
Yeah.
And I didn't see myself pursuing that per se. So I decided pretty late in my college career, towards, I think it was like my 4th year, to explore dentistry. I had my own dental sagas.
Story? Yeah.
And so I got to thinking, that could be interesting. I wouldn't want what happened to me to happen to somebody else, kind of, personal experience. And my dad, I was sharing the story with my dad at the time. He's like, oh, well, I know somebody at Sloan Kettering who runs like some surgical department, but maybe he could put us in touch with someone in the dental department. And that's ultimately what happened. I did it
at MSK.
Yeah.
Interesting.
Which was, by the way, a very highly specialized niche of dentistry.
Dental oncology or whatever it is. That's
Yeah. So we're dealing with, dental problems associated with oral, cancer, rehabilitating oral.
That's how you got started. Nice.
That's how I got started.
Great. Yeah. Thanks, Dad.
Yeah,
I mean, are you kidding me?
It was actually amazing because I think that exposure kind of opened, my view of dentistry, and it wasn't just about, okay, you're 6-month cleaning.
Right.
There's like so many different avenues you can go down. And the guy that I worked for this summer, his name was Dr. Ian Slotlow. He was an incredible
little shout out.
Individual. He not only was like really a hero at Sloan Kettering rehabilitating these cancer patients, but in his free time, he would go to Africa, Sierra Leone.
And do mission trips and
do mission trips in a refugee camp and rehabilitate, war.
And was he doing surgical stuff too?
Surgical stuff. Yeah. He adopted a kid from Sierra Leone who was orphaned.
Yeah.
I ended up babysitting them. So he served as a mentor for me in those early years where I was deciding to go to dental school. And
it's like, how do you fill those shoes? What an incredible person, incredible human being. Like,
it was.
I feel like I'm not doing anything compared to what these guys are doing.
It's amazing. So, I mean, ultimately, when I went into dental school, I was really interested in public health, and I started a mission to go to Nicaragua and
I
provide
wonder
dental
why.
care.
No, all right.
So see how all the
It's all coming
you
around.
just
I
gotta say
mean,
yes to these experiences because
have you been listening to our podcast? Because just say yes.
just say yes.
It is so important to just say yes. Things are going to happen when you say yes.
Agreed.
Now, sometimes it can be bad things, but things, and they're not all that bad, but most of the time, it's a good thing is going to happen. Just start saying yes. A good friend of mine, one of my best friends, he is a dentist, general dentist down in Homedale. And our thing is, yup. You want to do this? Yup. Just say yes.
Yeah,
And look what happens when you say yes.
absolutely. If I had said no, I don't know. I probably
So many
would be
things.
doing something else.
What do you think? What would you be doing?
Well, I was a
Used to-
psychology major, so
Sitting on the couch.
I don't know.
I'm
I
not
don't think
talking
so.
trash now.
I don't know. I'm not sure.
All right.
I think I made a good decision. I feel very happy with where I'm at.
Well, we're super happy that you made that decision. You're so amazing at it too. It's unbelievable.
Thanks.
All right, so do this thing with MSK. Now you know I'm going to dental school.
Yeah, so now I'm in dental school. That's a 4-year track. And then, I told you about this Nicaragua outreach that I got involved with. We would bring dental students and dental faculty, and we'd provide dental care. And that experience exposed me to, okay, dental cavities are rampant in these impoverished nations. They're rampant in lower SES communities in our own nation, and I want to be on the side of prevention. So I knew in order for me to be a part of that kind of momentum, I had to pursue pediatric dentistry.
You got to go start early.
Right. Well, I had to learn more.
Right. Okay.
And so that kind of solidified my decision to pursue a pediatric dental residency where we can focus on prevention.
Oh my God, amazing. And where did you do that?
At Columbia.
Oh, there we go again. There we go again. Starts her career almost at MSK. I know you didn't start your career there, but like having that experience and then NYU, then Columbia residency.
Well, how crazy is this?
So there's more to this story? Are we going to run out of time? No.
So it's crazy. I forget about these stories.
Right.
So that first year that I did that dental outreach, so we would bring down pretty much every specialty. There would be a faculty from endodontics, a faculty from oral surgery, from pediatric dentistry, general dentistry, and then there would be students within each of those, residents and students, dental students. And it was sort of like to learn, but also a public health perspective.
Absolutely.
As well.
You can perform these procedures as a student because you're the most qualified people that they're ever going to say.
Right.
So, yeah.
So my family had like a very small bed and breakfast in Managua, and we would stay there, and my aunt was running this hotel, and she became one of our patients, and she was like, I've been having this sore in my mouth, it's been here for a while, and the oral surgeon took a look, turned out to be oral cancer. Can you believe that?
Unbelievable.
On one of this is how we found it.
This is how you found
my aunt's oral cancer. Yeah.
Unbelievable.
So,
and was it a good outcome or no?
No, unfortunately. She passed.
It was too late.
I was advanced.
Yeah.
But Tia Luz, I love you. Always thinking of you.
Shout out. We're listening to you as well.
Yes.
All right.
Yes.
Oh.
So, there was a reason that we had to be there, and it was full circle.
Amazing.
Yeah. Amazing.
How do you do? And what do you take that back? And you're like, that's it. Like you got your view, your vision, everything like that. You knew exactly what you're going to do from there.
I was pumped.
As confused as you were, like freshman, sophomore, and junior year in college.
Yeah.
As clear as a vision was when you got out of that. That's amazing.
Absolutely.
Yeah.
Yeah. So then, I chose Columbia because they were doing a lot of work with public health, and I wanted to learn more about that, and it was a good decision.
It was a good decision.
I learned a lot there.
All right. Shout out to Columbia. There you go. Like we needed a shout them. Of course, they're pretty amazing over there. All right. So now you graduate. So you're a dentist.
Yes.
You're a Staten Island girl.
Right.
So
exactly. So we're living in the city at that point. I graduate, and I was splitting my time between, I knew my end goal was to be in private practice. Okay. I knew that that's what I wanted. I wanted to, I had aspirations. I knew I could run to practice, and I wanted to have that challenge.
Sure.
And see it succeed.
Yeah, you like things easy. I know. Yeah.
But I knew like my parents, so I'm not going to go into their story, but they just went right out of the gate and opened their practice. And I knew that probably wasn't the best decision.
Want
I
to get
needed
a little
some
bit
real
of
life experience.
exactly.
So I worked in a lot of different offices, different models, and I got a lot from those experiences.
Mostly what you didn't want to do, right? I'm assuming.
Mostly what I didn't want to do,
Yeah.
but I worked from some very successful practices, and I learned a lot there.
That's good.
What does work.
Yeah.
And I was also splitting my time as an attending, a voluntary attending at Columbia. So I would bring sometimes we have to do these sedation cases where we have to put kids to sleep to get the work done.
Mhm.
So I would take them to Columbia, and then the residents will assist me, and it's, we would teach.
You were passing it along.
Yes,
yeah, of course. Yeah.
Yes.
Paying it forward. That's the word. Passing on. Paying it forward. That's what I was looking for. Yeah. Thank you.
And then still involved with the Nicaragua outreach with NYU.
And you slept what, half an hour a night? What is it?
And so that was for 5 years, and I was sticking with my 5-year plan. I started to break ground on my practice in Ramsey when I was pregnant with my second child.
Isn't that how it always happens?
So, you just make it work. And then I worked in, then I was splitting my time, still working. I went down to one practice that I was working at in addition to my private practice. I did that for another 5 years until I got busy enough.
Another 5-year plan.
Yeah.
All right.
And now I've been in my office for over 10 years.
Scary,
We've
isn't it?
grown.
Yeah.
We have 2 amazing associates, like the dream team of staff who, our visions and work ethic and enthusiasm
everything's
is
in alignment. Yep. Yeah. Love that. You got TVs on the ceiling and everything. My kids love it. It's incredible. You got it all down. It's such a beautiful
we have all the bells
office.
and whistles, but at the end of the day, it's like, it's my passion. I have big love for little teeth, and like I think it shows when you come in that I really care about, instilling behavioral change, which is also a big challenge.
Oh boy,
in
children. And the adults and the parents, to tell you the truth too. But yes, right. Yeah. I mean, that's got to be difficult. So
it's difficult, but I think having the time to like hear people out and understand like what's going on here, what are the risk factors, what can we change, what's realistic, then we can make differences.
I love it. I love it. But it comes with challenges, these private practices, especially these days. And I mean, we run into the same thing over here, right? I mean, kind of insurance rules our world. How does that work with dentistry? Forget about even pediatrics.
Yeah, that's been really tough actually, because I mean, when I was starting out, I was obviously in network with every insurance under the sun, but I've come to realize that I'm not really able to provide the optimal like options and care with the restrictions that insurances sometimes will give me.
They say that they cover what is considered the standard of care.
Right. Like one example is, they'll downgrade to an amalgam filling, which is a metal filling, which I don't.
That's what you want to put in a kid,
which I don't even have.
Right. That's right. You know what I'm saying? Like, and that's the standard of care. That shouldn't even be considered the standard of care. But you're sitting here with an NYU undergraduate degree, a Columbia graduate degree, a dental degree, a Columbia residency, and you're an absolute stud. You're providing exceptional care.
Definitely.
Exceptional care. And the fact is, you really should be compensated for that exceptional care.
Well, thank you. I mean, I feel so. But at the end of the day, the operational costs have to, be paid off. Yeah. And in order for me to do that, I have to be out of network with some plans.
Absolutely.
I've tried to negotiate. In some cases, they've actually lowered their fees, which is insane after 10 years.
I'm trying to figure out in the world, I mean, right now with the buzzword of inflation that's been going on for however many years and everything, the cost of goods up 50%, eggs, we're talking about this, and we've gotten pay cuts.
Right.
And as if my lights are any cheaper or my rent gets any cheaper. No, everything goes up every single year. And how could they possibly justify the fact that they think we deserve a pay cut?
Agreed. And I'm not going to, use crappy equipment and crappy materials. Like I'm going to use the best possible materials that are going to last.
It's the reason why I go and see you, because I know I'm going to get the best of the best.
Thank you.
So what do we tell the people out there? Like, how do we, what do they have to understand?
They have to understand that if you have, most PPOs have out-of-network benefits. And most people don't realize that sometimes those out-of-network benefits are really good.
Okay. They still have some good ones out there.
Yeah.
All right, guys. They still have some good ones out there.
Sometimes, I mean, actually, I see a lot of times that they cover 100% preventive services, which means your cleanings, your x-rays, your
That's
sealants,
right up your alley
your
right there,
fluoride.
right?
It's the work. Like if
Yes.
you require work, sometimes the reimbursement is a little bit lower, but sometimes not by much. Maybe instead of getting covered at 90%, because none of it's 100%.
None of it is 100.
Yeah.
You're always going to have some kind of
Right,
out-of-pocket cost. That's
It'll
for sure.
be 80.
60, 50,
Yeah,
if it is, right.
Yeah. It's a range. It depends on, and at the also, I think what people have to understand is it's your HR department that's picking these insurance plans. So really, it's up to them to pick the good ones because there are different tiers.
Yep.
So
right, and then you get the options based off of what they choose for you.
Correct.
So, well, in every single aspect of this world, you get what you pay for. Right. I mean, it's just so you get what you pay for. And in order to get better quality and better service and better equipment and not using metal on children and not using subpar materials, because that's what people pay for, it's going to cost. But it's absolutely worth it.
Well, and I hate to say this because my hope is that that insurance-based practices don't all run this way, but some do, and some run on the volume of services that they're providing to keep up with, the lower reimbursement. So
you make it up with volume, which how does the care then
I can't
suffer?
do that.
I'm in the same
my
boat.
conscience can't do that.
In the same boat.
So, I rather prevent your issues and not get paid for the filling than see you suffer from a filling and do work that's not necessary.
No, unnecessary work or subpar work only because, I have 15 people waiting for me and that's just not going to happen.
That's it.
At Valley Smiles Pediatric Dentistry, it doesn't happen here at the Spine and Health Center either. And I can absolutely commend you for doing it because it's tough. It's tough because it's like a business in the dog-eat-dog world over here. And for us to hold our guts, and I really do commend you for that.
Thank you.
You guys
are doing the same.
We do the same thing here. So,
by the way, another challenge that us dentists have is our ergonomics, our posture, our back pain. And I come here for my treatment. And
welcome to the club. I got to hunch over all my patients too and work chiropractors. So yes, obviously it's all prevention. We talk about it's spinal hygiene, it's dental hygiene.
Thank you, Dr. Deanna.
Oh, Dr. D, a little shout out to you too. Or Caldera, Dr. Caldera with like 11 shout outs. It's a world record on the local BizCast over here.
Spread the love.
Unbelievable. You're not going to believe this. We have 4 minutes left. Actually, probably under 4 minutes left because I started that a little bit late. Is that ridiculous?
Fast.
Did we get to anything?
I can't believe it.
I want to make sure we get to absolutely everything that you want to get to because.
Yeah, I mean, I think we covered it. It's just like, guys, establish your dental homes. Make sure you're getting your children in within 6 months that the first tooth erupts or by, the first birthday.
1 year, latest.
One year.
But if they get that first tooth at 3 months, you got to get there in 9 months.
Listen, this is another crazy fact.
Crazy. I freaking love it. Come on, give it to us. Go.
2.1 times more likely to develop a cavity with each year that you don't go. So if you come in at age 5 for your first dental visit, you're 20 times more likely to have a cavity.
She's a stat freak. I love it. Look at 2.1, 20% more. I mean, like, oh my God, it's absolutely amazing.
I mean, isn't that insane?
You're amazing. I knew it already, but I love doing this with people I know because I learned so much more. It's incredible.
This is fun.
I didn't even know you went to Nicaragua all those times, and it was unbelievable. So I'm intrigued. Ladies and gentlemen, Dr. Aura Caldera, Valley Smiles Pediatric Dentistry in Ramsey, New Jersey. Oh, I know it. Can I say it? Like you're right next to like Don Bosco over there. All right. And I shouldn't say this.
By Kinchley's
I was just going to say that, but you're the dentist. I can't tell you about that
pizza.
over there.
I don't have any problem with pizza.
Right. There's a little sugar, a little oil.
By the way, everything's in moderation.
There you go.
Let's be realistic. My kids eat sugar. Okay. They do. They eat candy.
Oh my God.
But guess what? I brush their teeth.
Oh, you brush their teeth or they brush their teeth?
I brush it.
You do it.
Not my 13-year-old.
No, you better not.
But I did for a long time.
Until yesterday. Maybe until today, now that she just put it on over here. So thank you so much for joining.
Anytime. My pleasure.
Incredible, guys. Go visit her. You have no idea. Even if you thought you had an amazing dentist, and I'm not going to talk trash about that, She is amazing. You don't even understand the experience. It's worth going to see one time at least. And if you don't believe me, then you can go back to the other dentist. But I think it's just an incredible experience because you can see the quality, you can see the passion, and you're getting the best of the best over there. And it's just absolutely worth it.
Thank you so much.
Incredible. Ladies and gentlemen, Dr. Aura Caldera, we are back on track because we are doing a ton of these podcasts now every week. I don't know how I turned into a full-time podcaster, but I am, and I freaking love it. So here we go. This next guest, I am pleased to announce, is going to be on Monday. It's February 24th at 5:30 p.m. And it is Stephanie Narciso. And she is from Rain and Root Aromatherapy. So definitely join us on Monday night, another nighttime one. I like the way this place looks on Monday night. You can see like the blue light and it pops over here. So
very zen.
I hope you will join us on Monday night on YouTube Live. I hope you guys enjoyed Dr. Aura Caldera from Valley Smiles Pediatric Dentistry. You guys should go visit her immediately. I look forward to seeing you guys next week. Have a wonderful weekend. Take care, everybody.
Thank you.
Aw, there you go.